Good morning, everyone. Today is World Arthritis Day, and arthritis is the swelling and tenderness of one or more joints. The main symptom of arthritis are joint pain, stiffness, which typically worsen with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis causes cartilage hardening, slippery tissue that covers end of bones where they form a joint to break down. Whereas rheumatoid arthritis is a disease in which the immune system attacks the joints and at beginning with the linings of joints. So uric acid crystals which form from where there are too much uric acid in your blood can cause gout. Infection or underlying disease such as psoriasis or lupus erythematosus can cause other types of arthritis. The treatment of arthritis may vary depending on the type of arthritis. The main goal of arthritis treatment are to reduce symptoms or improve quality of life. The symptoms mainly include varying capacity of the joints. Depending on the type of arthritis, signs and symptoms may include pain, stiffness, swelling, redness, decreased range of motion. There are two types of arthritis, as I told, osteoarthritis and rheumatoid arthritis, and which may damage in various proportion. So the most common type of arthritis is osteoarthritis, which involved in wear and tear, damage to a joint's cartilage. The hard, slick coating on the ends of bones where they form a joint. Cartilage cushions the end of the bones, allows nearly frictionless joint motion, but enough damage can result in bone grinding directly on bone, which causes pain and restricted movement. This wear and tear can occur over many years and it can be hastened by a joint injury or infection. Osteoarthritis also causes changes in the bone and deterioration of the connective tissue that attach muscle to bone, hold the joint together, and if cartilage in a joint is severely damaged, the joint lining may become inflamed or swollen. Whereas in rheumatoid arthritis, the body immune system attacks the lining of the joint capsule, a tough membrane that encloses all the joints. This lining, called a synovial membrane, becomes inflamed and swollen. The disease process can eventually destroy cartilage and bone with the joint. There are various risk factors which involved in the arthritis. That includes family history, age, your sex. So in this age, women's are comparatively more susceptible towards gout, rheumatoid arthritis, and other types of arthritis. Do include on men also, males also. Then previous joint injury, people have injured a joint perhaps while playing sports, running on a treadmill, gym or farming or any kind of activity are more likely to eventually develop arthritis in that joint. Next is obesity. Carrying excess compounds puts stress on joints, particularly your knees, lips, hips, spine. People with obesity have a higher risk of developing arthritis. There may be various complications related to arthritis. So once you get any kind of problem related to arthritis, you must visit to a physician, and the physician can tell you about the medical diagnosis, the lab test, and overview. It may happen to various areas of the body. It can be feet, it can be hands, it can be hips, it can be knees, it can be lower back, and also spondylitis, juvenile arthritis, gout, psoriatic arthritis. So certainly lifestyle factor is one of the prominent job. The job puts you into related stress on our joints or family history of joints also, or any autoimmune diseases or viral infection. Pain, redness, stiffness, swelling, tenderness, warmth is also one thing. When you go to the orthopedician, can give you X-ray, MRI, PET scan, or bone fracture, cartilage, or ligament, tendon injury, soft tissue inflammation, etc. Are some kind of things which relates with the joint. Its management medication are involved, which are given by the orthopedician, whereas the physiotherapy, rehabilitation, therapeutic injections, cortisone shots, etc. are the therapy, whereas fusion, joint replacements are other parts of this medicament, which is late stage complications related. Arthritis can be prevented by avoiding tobacco products, doing low impact non weight bearing exercises, maintaining a healthy body weight, reducing your risk of joint injury. So prognosis or prophylaxis is related, and occupational therapists may be required. They may provide you the specialized healthcare in managing physical challenges like arthritis, and they may recommend you adaptive equipment such as a grip for opening jars, techniques for doing hobbies, sports, or other activities safely, tips for reducing joint pain during other arthritic flare-ups. So a disease of joints and which can cause pain and reduce mobility, so in which a lot of precautions has to be taken. So on World Arthritis Day, Saurabh Kose suggest all of you to take care of your health and get expert treatment or health essential services from occupational therapist, physiotherapist, or orthopedician when and so you feel that you have joint pain and which is everlasting. Thank you so much.